It's a day like any other in this public hospital in Rabat. However, behind the scenes, much has changed in recent years. Today, patients can enjoy the effects of unprecedented reform in Morocco's system of health insurance. This major development is the result of a unique cooperation between Morocco and the African Development Bank, which provided a support funding program to reform medical care. The aim was to provide the country with universal health coverage and modernize the health system itself. The measures protect the least well-off through the RAMED, or Medical Assistance Regime Fund. Lubna, a 32-year-old mother who has injured her arm, is a beneficiary.
This is the RAMED card. It's me and my husband and 2 children. It's for the family, the whole family. With the RAMED card, I can benefit from all hospital services. Consultations, x-rays at hospitals or health centres are now totally free for my entire family. This is the RAMED card.
Lubna is just one of the 6.5 million Moroccans who now benefit from this medical assistance program for the needy, which has resulted in a steady increase in patients and better quality care.
Our concern is for the patients. The RAMED card means free access to care, access to complete care. There's no problem now for evaluations or additional examinations.
Des examens complémentaires, donc on ne trouve pas le problème qu'on trouvait avant, celui de.
It is no longer based on the patient's ability to pay, so it's really a good thing for those who need treatment.
Un grand bien pour le malade.
Before RAMED, there were many difficulties in financing healthcare. Today, with the RAMED card, I have no problem. Especially since the administration has set up a dedicated office to receive and guide cardholders to the various hospital departments. It's good.
Until then, the system of free medical care for the poorest members of society was managed somewhat haphazardly, as managers in Morocco's hospital system tried to accommodate demand. Free healthcare was arbitrary and caused growing inequality as well as smothering attempts to modernize hospitals.
It was a bit of a mess, actually. The reason was we had to make do with a state subsidy, and the subsidy was generally inadequate because you couldn't predict the number of patients who would come to the hospital. So there was congestion and confusion. Now it's more ordered. Now those who have nothing, those who are economically weak, they can come to the hospital with their card and are treated on the same basis as people who have money who have insurance, or who have private coverage or private health insurance.
Morocco began undertaking efforts to modernize its system of medical coverage in 2005. The first phase of the AFDB-funded Parkoum support program strengthened the basic medical coverage of the official workforce. The second phase, Parkoum 2, focuses on the implementation and success of RAMED.
Our coverage reached 53% of the population, if you can count all the various plans. That is to say, obligatory medical insurance and RAMED.
The bank is the main partner with the European Union in the implementation of the healthcare system. We've supported the program since 2005. And with a little over 290 million euros invested, it's allowed the installation of medical coverage and its application to all segments of the population.
Morocco and the AFDB are currently pursuing this mission with Parkoum 3. The aim of the third phase, worth $115 million, is aimed at coverage for the self-employed, an informal sector largely devoid of health insurance or social security. The Kingdom also hopes the program will allow it to accelerate the reform of the sector.
The speed with which the system has been implemented, since we're now reaching 75% of the target population, is something quite extraordinary.
This momentum allows Morocco to look ahead and move confidently towards rationalising the funding of the health system, with more appropriate care and better managed hospitals, a valuable example for the rest of Africa.